Good morning, sir, and good morning to the viewers.
Now, you are from a nursing and a health background. Please tell us about what is it that your organization is involved with in the field of HIV and AIDS?
Currently, my organization is involved in encouraging communities to go for HIV testing. We realize that if we want to reach to zero infection by 2030, it is quite important that everyone knows their HIV status so that they can get treated, and by so doing, they reduce their infectability. And so what we are doing, we are trying to normalize this epidemic of HIV. We're providing a number of services. We do assessment for diabetes. We also assess people for hypertension, and then we also talk about STIs, about TB, and then we do the HIV testing so that people can see, so that people can understand that HIV is just like one of the chronic illnesses.
Mm-hmm. Now, how do you manage to operate, especially in the rural areas of KwaZulu-Natal, where poverty is rife, which we know, and with orphan child-headed homes, and working with women who often depend on their men for their income?
Yes, we were quite fortunate that we are currently working with a well-known organization called CAPRISA. And CAPRISA, we know that they are doing a lot of research. So what we are doing, we are out in the community for people to understand research and also to help mobilize the communities. We are working mainly in the Umgungundlovu district, out in the communities, because it is these people out in the communities that we need to encourage to come forward for testing. Otherwise, if we are staying in the clinics, if we are staying in the hospital, there are many people that are going to be left out in the communities. As we can see, there are people who have never had checks for diabetes, they've never checked for hypertension, and they've never been checked for HIV. Hence, it is important for other people to go and work out there.
Mm. Now, what were some of the crucial lessons that you've learned from this project, especially surrounding the secrecy of HIV-Aids and people talking about sex?
Yes, I think what I've learned, as you know, that I started working in HIV and AIDS a long time ago, is that at least stigma is still there, but it is not like what I used to see in the 90s and early 2000s. But I've also learned that, communities are people and they just need that push. They need education. They need to understand why things are done and why we're encouraging them to go for testing. But we're also encouraging them to work as a unit, to work as a family, to support each other, because it is in so doing that people will not be scared to go and test for HIV. They will know that at least even if I test HIV positive and I go back home and I tell them about my status, I will be accepted. And if we encourage the whole family to test, because we take a mobile service, we go there and people come to the mobile, we advertise beforehand, but we also go to their homes. And those that prefer to be tested at home, we test them at home so they can test as a family. Maybe oddly others, they do not want to test as a family, but in so doing, by visiting them in their homes, we get many people agreeing to testing. And we can encourage them to stay as a unit and to support each other so that the one who tested positive will be free to say, I am now HIV positive. You need that support from home more than you need the support from the community.
Now, that's very important, but you also focus on men. How difficult is it to break those barriers and sometimes address the patriarchal and the traditional behaviors of men?
I started working with men, interestingly, in 1998. And I found it to be easy. I think men are afraid to be sick. Men are afraid to die. And men, on the other hand, they pretend to be strong and they pretend to they want women to be afraid of them. But if you talk to them, if you talk to men, they do listen and they do take things seriously. And also, by bringing to their attention that this society is patriarchal, we look at you as our fathers, we look at you as our brothers, and we expect you to protect our mothers, protect our daughters, our sisters, protect your children. And in that way, you are creating a sense of responsibility and a sense of ownership and a sense of, men need to be responsible people. And therefore, they listen. Even though it is not easy, but we are seeing a trend now where when we started, more women came for testing. And maybe they will test about 50 women and there will be only one man. But now, men in that communities are quickly catching up. At times it is like 50%, 50%. So I think we are getting there. But what also helps is that in that community, we did a lot of work around voluntary male medical circumcision, and they appreciated it. We did a lot of education. We went back to them to find out how they were doing. So already we are accepted in that community. And when we go back now to ask for their support in these other issues, it is not so difficult. But also these men in that community.
Mahlase, unfortunately we've run out of time, but thank you so much for your time and being with us, and keep up the good work.
Thank you so much.
That's the founder of the COMMOSAT Gethwana Mahlase, joining us from our Durban studios to talk about their activities there.